Cities Thrive is a national coalition of municipalities and counties across the country that are fighting to reform both the way that we look at mental health and the way that we treat those who are suffering from mental health disorders.
Cities Thrive was started as a program in New York City by New York City First Lady Chirlane McCray and her husband, Mayor Bill de Blasio. Recently, I joined mayors of Madison, Wisconsin, Mesa, Arizona, Alexandria, Virginia, as well as Congresswoman Napolitano and New York City's First Lady Chirlane McCray in Washington, D.C. to lobby our senators, our congressmen and women, and to suggest that they need to recognize that we are currently under-resourced in the fight to provide adequate mental health resources to the people in our communities.
Across over 150 cities and counties representing 50 states and the District of Columbia, mayors and county executives have come out to say that they think the way that we deal with mental health needs to be destigmatized, needs to be treated appropriately, and needs to be treated like any other health condition.
Right here in Salisbury, we're doing a couple of things to be a leader in this fight.
We have taken on a number of evidence-based practical solutions.
We are focused on two sort of lenses through which we're seeing this challenge. And in Salisbury, we're seeing it firsthand in our homeless population. And that is a problem and a challenge that many communities deal with. But the way we're addressing it in Salisbury is we are providing permanent supportive housing, including mental health case management through a partnership with the Wicomico County Health Department for a variety of people, and particularly those who are chronically homeless in our community.
Homelessness, first and foremost, is an economic problem. Homelessness affects people across the spectrum, but those that have mental health disorders or substance use disorders are particularly vulnerable to homelessness. People that find themselves on the street or in a shelter have no idea what to do. You add in problems like schizophrenia, bipolar disorder, alcoholism, it makes the problem so much worse, and it compounds it. So that's why we as a city, from a humanitarian standpoint, have stepped up and said, we aren't going to allow this to happen in our city. So we've created a permanent supportive housing program to allow these individuals to gain a sense of dignity and start the process of recovery, understanding the root causes of their homelessness and the triggering episodes.
Secondly, we see this as a mental health and substance abuse challenge. And so the people who have found themselves addicted to substances, opioids, and other drugs, they find themselves, again, with inadequate care. And certainly our community has a challenge here, and as does everywhere in the country. So what we're trying to do is respond to that crisis through a partnership with Wicomico County Health Department and State's Attorney's Office through the COAT team, that's the Community Outreach Action Team, which provides peer resources in guiding people into the recovery process. Additionally, this week I received a report from Salisbury's START Task Force, that's our Substance Treatment and Addiction Reduction Task Force. And this team of over 30 individuals who are engaged in the treatment process have been working to help Salisbury officials like myself and our city council respond to the opioid crisis through Salisbury's means. We certainly recognize that there are nonprofit, county, state, federal, and private partners in the process, but we needed to hear what the city of Salisbury was going to do. So we're responding to the mental health crisis through a variety of means. We're also looking for additional federal support. Many of the programs that we provide count on and rely on federal funding, but it goes beyond that, and it requires ultimately the insurance system and our healthcare system nationally being designed to treat mental health just as any other physical ailment.
So we're very happy to be able to say that we, as a small town, are doing these things and can stand with national leaders such as Congresswoman Napolitano, Senator Baldwin, and First Lady McCray to address these issues head on.